On this show are those of the authors. Any content provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Amendment?
Yes. Hello, everyone. This is Dr. Michael Kachmar. Welcome to Scrubbing Up with Dr. Michael Kachmar. Today's date is May the 23rd, the year of our Lord, 2023 AD. And this is, we haven't had a show for a while. Apologize for that. So we're here.
Busy.
We're busy. Sean, maybe you could also pull up the, you could put a lifeguard on duty, pull up my what do you call it? Yeah,
I got it.
Yeah, the things that come up. Anyway, so we have Sean here. Here's Sean. Say hello, Sean.
What's up, guys?
Sean's the sidekick today. So I'm Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. I'm on staff at many hospitals. And I do a lot of reconstructive surgery. And this show is basically a medical, political medical show. And we're on all your platforms. We're on YouTube right now. We're on Rumble, Facebook, Twitter, Twitch, Spotify, Apple Podcast.
All over the internet.
Oh, yeah. Can you, there should be a spot there where you can pull up my information. So if you want to get a hold of us, send us an email. It's drkachmar@icloud.com. So that's drkachmar@icloud.com. And I know Sean's having a hard time.
Yeah,
look at our overlays, Sean.
It's not working, Cash. It should be still grayed out. I don't know what happened. We've haven't been here in weeks.
Go up to the top here. So we're live right now. We just want to get you some information on there. And there, see all those things?
Well, most people are listening to us anyway.
But go here. Go down here. It says Jersey Shore. See that T? It says DR.
I'm clicking on it.
Hit that. And it's not coming up. Okay. All right. Well, and anyway, thank you for tuning in. So we have a lot of things we want to talk about today. We have an ongoing discussion about this gender dysphoria, which is big in the news right now. There's a lot of stuff going on with gender dysphoria, and of course, what comes after that is gender-affirming treatment.
It figures this works.
Yeah.
If you're looking, it's an old picture of Cash.
All right, so let's go to the, so here's our whiteboard today. We have our whiteboard. So here, if you look here, and this is something that I think is important for people to understand. So you have basically the first thing is the diagnosis of gender dysphoria.
I'm sorry. On top of your doctor handwriting, you had to do it in cursive this time?
Yeah, you like it?
Oh my God.
So you have gender dysphoria. So gender dysphoria, for people who don't understand that, this is what people think in their mind. So they think, and they have feelings too, but basically they think that their body they're in is not appropriate. And they call that gender dysphoria. And there's other things that go along. They may want to wear dresses or pants, or so there's all kinds of things. You could look it up, but that's what happens. That's the diagnosis, gender dysphoria. Once you have that, okay, then what happens next is gender affirming treatment. Now, gender affirming treatment could mean a lot of things. It could mean, say, if you're a boy and you think you are a girl, you should have a girl's body. You could start getting counseling with a psychologist, and you could maybe wear dresses, wigs, whatever. You know, there's the whole thing into that situation. So the lifestyle and the movement towards that gender. Now, the next stage would be medication. That's the big push, medication. They're called puberty blockers. And then ultimately, there's surgery, okay? So what's going on now in the country is that a lot of doctors, there's a lot of places that are pushing treatment as early as possible. And there's big universities.
Why do you think they're doing that?
I have no, well, I think that a lot
Best
of them believe,
guess.
well, I don't think there's one answer. I think there's people who really believe that it's a medical, it's a medical situation, it's a medical phenomenon, and the earlier you treat them, the better off the outcomes will be. I'm going to give you an Axios article, and we'll discuss that.
How do you think they think treating children early who don't even know how to form full sentences Why do you think they think that helps?
That's a good point. I think you look at the literature. Let's stop and say this, because it's a good premise to start with. What's happening is these people who have gender dysphoria have a high level of being unhappy and also committing suicide. So they die, and they have horrible, unproductive lives. That's been the problem. So they have been trying to work on this. Over the years, they've been doing surgery when these people get older, 20s, 30s, and it has varying degrees of success.
Yeah,
now,
do you think it's just something?
Wait, but you're asking me a question. Let me finish though. Hold that thought.
Okay.
But now there's research, and some people are saying, well, the problem why they're not doing better is because we're not getting them early enough.
Yeah, you think that's like some statistic that they're just
Yes,
that they're looking at?
There's studies, yeah,
pointing at this is the cause.
Yeah. I don't think these studies, in my opinion, that I've looked at are credible. They're very they're not 100%, and they're not double blind, effective.
No, in school I learned that statistics only ever show you what the person presenting it wants you to believe.
Yeah. I mean, but so you're asking me the question, and the reason is that they believe now the earlier the better. And I'm going to explain and give you some articles here that point to it, and some people that point to it. So they're saying is the earlier the better, and then you have better outcomes. I don't believe that, and there's states that don't believe that, and in the states. One of the states is Texas. I think they're banning transgender treatment, gender confirming treatment, and minors. And that could be anything between under 18 or under 21.
Do you know what DeSantis
but not
is
completely.
Doing? Do you know what DeSantis is doing with Disney?
Yeah.
What's going on with that? Is he just not funding them or something?
Yeah,
it's about this stuff.
It has a lot to do with this. Yeah, but let's do this. Let's go to this Axios article here, because this you mentioned this, and this is where. So this is an article from Axios. Can you go? Yeah, go to my iPad, please. Yeah. So no, iPad. One back, down, right there. So this is an Axios article from May 17, 2023. So it says the thoughts fight to stop the trans health care bans. Okay. So what's going on here? So across the country, Democratic lawmakers in GOP states have struggled to stop an onslaught of bills restricting gender-affirming health care for the transgender minors. Now, a couple of points. One is, they're pitting the Democrats against the GOP, which is not the case. A lot of people on both sides don't approve or appreciate or believe that children should be having the surgery or treatment. So I don't believe I think it's by.
So you're already calling out the objectivity of this article right here.
Also, I want to point out that we're all talking about minors. All of the bans that I've seen that are coming across in the country for treatment are for minors, not adults. I don't think anybody out there is saying if you want to have it done and you're over 21 or over 18, then have at it. But also, you got to understand, a lot of the states like New Jersey will pay for it. You have Medicaid-based insurances. And that means your taxpayer money is paying for this stuff. And I don't want my taxpayer money. So let's go here. So here, driving the news. A Texas bill to ban hormone therapy, puberty blockers, and surgeries for minors could reach the governor's desk this week. Bigger picture. More than a dozen states have passed similar bans. Advocates and experts say it's in part due to the misinformation that has been proliferated about a subject most Americans don't understand, affecting a very small population. So an estimated 0.6% of American ages 13 and older identify as transgender, and nearly 1 in 5 are ages 13 to 17, per the Williams Institute, which is, you could go and look at that article. Plus, the number of trans minors who feel safe to speak publicly, let alone testify in a legislative hearing, is even smaller. What matters? Here's the key. Major medical organizations consider such care necessary and potentially life-saving. That's something you have to understand. So here's a woman here. This is so it says what they're saying. As a physician, this is in quotes, it's been frustrating to see policymakers act in ways that I truly believe it takes clinicians decades of education, experience, and nuanced understanding, says Utah Democratic State Senate Jane Plum, a physician and parent of a transgender daughter who tried to fight the state ban. So there's an interesting thing. So this is what you have. So you're pitting doctors against doctors in this country right now. This is big. So you know, I'm a physician, so I see this going on. There's doctors who are making money off of this. There's doctors who are approaching it. They're building buildings. There are pediatricians who basically used to take care of colds and sniffles. Now are banging the door on treating alcohol addiction, gender dysphoria. So this is an interesting article here. So here's the thing. So State Senate Sally Harrell told Axios there's a lack of knowledge on both sides of the aisle. Also, the parents of transgender children. So this is interesting. So it goes on. This is a great article. I would tell people read this Axios article, and here's some of it. Here's what they call here opinions representing misconceptions. It is the rhetoric that is sweeping our nation. There's something wrong with these kids. It's not that they're trans; they're just mentally ill. So we need to fix them. That's one argument. But the fact of the matter is,
this article is saying that's
no. This is just these are misconceptions.
So this article is saying that that's wrong.
Well, yeah. But the fact of the matter is that depression, that anxiety comes because of the gender identity struggle. So they're blaming everybody else
when it's not affirmed.
Yeah. So let me give you a little history. When back in the day, if you were gay, you were considered mentally ill, and you were criticized. People beat you up. You were bullied. Same kind of crazy stuff. Today, in the United States, it's a lot more acceptable. I mean, we have gay marriages, but a lot of the world, gay is not recognized, and people won't even talk to you. You don't want to drink out of the same glass, a cup or something. So it's an interesting thing. Now, is that mental illness? So a lot of people say it's something in your brain. You're born that way. Just so you're born gay, you're born, and I'm not saying that this is an illusion. Some people are saying that.
What's an illusion?
Gender dysphoria.
Okay.
It's a hysteria, but it's been around for years and years and years. So I doubt that. I mean, 30, 40 years ago, there's a guy in Colorado doing 100 transgender surgeries a year. So I don't think that's the case. I think people are truly, have this position. Whether or not it's mental illness, it's something in the brain, I don't know. That doesn't matter at this point. The argument is, focused. I want to focus on this does exist, and what should we do about it? Good example. I've dealt with patients who are pedophiles. They want to have sex with 10-year-old kids. Now, we don't allow that because we know that screws up the kids.
Did you see somewhere
but you're born like that.
Yeah, did you see somewhere in Europe someone was trying to advocate for pedophiles? I think this is pre-pandemic.
In the Greek Empire, in the Greek they had man, boy, that was normal. You had guys, you had people who would have women, girls, young kids, young boys. That was that society back in the day it was open. It wasn't, so it's nothing new. I mean, they've been pedophiles. Now, again, do we accommodate that? You have to draw a line. So what I think I'm trying to make here is that, what a lot of people are saying is we're not against transgender surgery and treatment. It's with the minors, because a lot of these kids are going through puberty, and a lot of them may outgrow this. That's my point. So let's just go here. So here says the very induction of these bills have already taken a toll on the mental health of trans. So they're blaming. So see how it's going? It's going back and forth now. God forbid you say anything about it. I'm very sure people will criticize our show here. So I'm just going on and on and on and on. So here's the thing of note. The use of puberty blockers on trans minors in the United States first happened in 2007 in Boston. Boston Children's Hospital has been a pioneer in transgender treatment. They were criticized. They said that they were doing stuff on minors. They said no. But I looked at their webpage. They will do top surgery, which is removal of your breast at 15 with parents' consent, and like a year or two of treatment with gender dysphoria or gender affirming treatment, which would be psychological evaluation, maybe puberty blockers. I don't know. But so that's interesting. Here, some will suggest it is for a mature 16, 17-year-old, but surgery really is something that's largely reserved for the adult population. So these are the other things. None of the current trusted protocols are recommending that the minors outright get surgery, says Rafferty, a pediatrician and clinical psychiatrist who chairs a section of the LGBTQ health and wellness for the American Academy of Pediatrics. So he's saying no. So you got this argument, going back and forth, okay? I just want to put this out here. And let me see what else. Is there anything else here? I want to go here. So here's the bigger picture. And this is what I think is interesting about this. And here it is. Undergoing all of this has been they've been doing epidemiological research on transgender community broadly. And there's a need for more data on how puberty blockers affect bone health and research on those who might change their minds about hormonal treatment. Okay, that's another thing. In some of these areas, the lack of research has really shown opinion, and often opinion represents misinformation or misconceptions about what is actually happening, and to come into the dialogue. And so that's where you're at right now. You could get rid of this. You could put me back in here.
I was trying to find how many minors get breast implants.
No, not implants, but the other ones they removed their
the
breasts.
top surgery is removal, but
right.
So there's 4,830 minors in the U.S. I don't know what year. I could check.
2011.
2011.
So there was. Here's you're pulling this up here. Was it nearly 330,000 breast augmentations? But how many of them were in adolescents?
This is 10 years ago. This is so.
Yeah,
far.
that's just kids having breast implants.
No, I know, but I wanted
another
to cross-examine how many of that percentage gets the surgery.
Get out of this one for me.
You're in it.
No, I want to get put me just on so I could see the I want to see I want to go here. So what I'm going to give you. So what's happening is kids before all this transgender they've been getting breast implants, but you had to be 18, but you could get breast implants younger with parents' consent. So it's been crazy, It's
just literally what we're talking about.
Yeah. Yeah, so more teens get breast implants
than trans top surgery.
Yeah. So, that's one way to look at it. We're a crazy society. But here's the thing. Let me make a big point. Breast implants are reversible, and you're not removing tissue. It's a big difference than removing your breasts. You understand?
Yeah.
It's huge. It's not. It's like night and day. So, but it's not the same. You could remove the implants.
You said it, so I was thinking about it.
No. I kind of, a little bit. I think that's a little bit, So I want to get another article here. So the other one, I wanted to make one here where, let me see here. There's one here. So that article is pretty good. I think it's an interesting, perspective. But I think it's two different things. I really do. I really think it's two different things. And let's go. I want to pull this up about the band here. So let's go back here. So this is an interesting thing. So Florida.
Go back to the pad.
Yeah, go my thing. So Florida here. This is a good one. So as care ban becomes law, transgender Floridians face excruciating decisions. We're just people. So this is an interesting thing. So this is the other side of the coin here. So in
Rito Hendricks, what a name.
Yeah. So after knowing he was transgender since childhood, which is interesting, the 31-year-old finally built up the courage to start hormone replacement therapy. He visited a Planned Parenthood clinic. Now, this is interesting. This is another political thing. Planned Parenthood is funded by the federal government, and they, push big-time abortions, just so you know.
Why do you think the federal government pushes big-time abortions?
I don't know. That's another whole. Because I think they're evil. I think it's abortion.
You think they're evil? No. They might be. They might be.
Abortion. You could spend another whole day on abortion, but abortion. Remember, it's killing life. And I'm.
Yeah, but why do you think big government pushes abortion? Where's the profit in it?
Oh,
right. Follow the money. That's pretty much everything.
Yeah. There's a lot of people who make money on abortion. They make tons of money.
You think it's just the surgery, though? You don't think they're using those fetuses for adrenochrome and stem cells?
Listen, I think.
Do you know what I'm saying when I say that?
I'll put history. If you didn't, before you had legal abortion, there were back alley abortions. People will get abortions. They get pregnant. They didn't want to get pregnant. They want to get rid of the baby. It's as old as the hills. Abortion's been going at times since Jesus Christ's time. Okay, so Planned Parenthood came around. if you look at Planned Parenthood, the original woman who did it, it's controversial. We did a show on it, but basically she did it to wean down the black population, to control the black population. And if you look at
if you look further with tinfoil hats, do you think that's the actual reason? Or?
No, that was the beginning.
No,
Everything starts. If you go look, there's a book called Freakonomics. Back in the 70s, when abortion became law, before that came, there was a whole thing in the United States where they thought that the young black kids with no fathers were criminals and they were going to take over the United States and kill everybody. It was, I'm telling you, it was that rhetoric. And then abortion, when it started, and you could look at the abortion statistics, how many inner city black, Hispanic people who are poor are getting abortions, way more than other people back in those days. So there was an argument and an allegation that abortion came about through Planned Parenthood to wean down the population, especially of unwanted population. Then it's changed over the years. It's funny.
Yeah, but putting your tinfoil hat on again. Do you
today?
No. Do you think that the Freakonomics fact that was a thing against black people was just another way of just separating the population by saying there was racist ties to the beginning of this?
I don't know.
Right? But it's possible.
Yeah, I mean, what's happening now is people, they got the civil rights, women's rights, my body, my right. And, to me, Planned Parenthood, all their money, all their effort has been to abortion. How about funding adoption? We could have money, I would rather have, abortions. President Clinton said this. He said, President Clinton, and I think, abortion should be rare and, only, and infrequent. Now we're doing it crazy. In New Jersey, just to reiterate, go over what New Jersey is: abortion on demand. There's no time limit. You could be 9 months pregnant. There's no waiting period. And if you're under 18, you could sign your own consent. You don't have to have parents' consent to have an abortion. And the state of New Jersey will pay for it with taxpayer money. That's how bad it is in this state. So getting back to, let me just go here with the Planned Parenthood. So so he visited the Planned Parenthood clinic near his home in Palm Beach County, began taking shots of testosterone, okay? 3 months in, listen to this, I'm the happiest I've ever been in my life, Hendricks said recently. And they said a lot of times, though, that you feel really great when you get on the blockers. But on Wednesday, with the stroke of Florida Governor Ron DeSantis' pen, access to that gender-affirming health care for Hendricks and thousands of adults across the state is in jeopardy. Now, here's where the disinformation is. This article is from who? This is an article on The Nation, and this is by this Karen Varn, V-A-R-N, USA Today. But all DeSantis is banning is for minors. He's not a minor. So why is she writing this article saying that?
He was a minor when he originally had...
Yeah, but now he's getting the treatment. Now, here, look.
Yeah, but he was originally a minor.
But
when he got the treatment.
No, he's just
Scroll
starting.
To the top.
No.
Go to the top.
No. After knowing he was since childhood, the 31-year-old finally built up courage to start.
But after knowing since childhood.
Okay, but he's not going to be stopped. It says here, he started the therapy now at 31 years old. It says, but on Wednesday, with the stroke of a Florida Governor DeSantis' pen, access to that gender-affirming health care for Hendricks and thousands of adults across the state is in jeopardy. No, it's not.
Gosh, it's in the first line. Go back. Since he was a child, he felt this way and just got the courage to do it. Probably
at 31.
Yes, but that's not the important part of the
No,
sentence.
the important part here is this article saying that he is not going to be able to get it now. He started it just now, a couple days ago, a couple weeks ago, right? Real time. And he's not going to be able to get it anymore because of this legislation.
The article's using Rito Hendricks as like this person always wanted treatment and now is getting it.
Right. But they're saying
he wishes he had it his whole life. That's what they're saying.
No, the article's saying that he's in jeopardy now. Look at it. It says now that because the ban just was affected, Governor DeSantis just signed it a couple days ago.
It's a slippery slope.
No. That's bullshit. It's very specific out minor. Look. Republican leaders across the county have banned minors from accessing transition-related care.
Cash, just like you were saying that it's a slippery slope banning TikTok, it's a slippery slope.
No, because it's been
initiating any bill.
But here's the thing: transgender surgery has been going on for 30, 40 years.
You're practicing some heavy cognitive bias right now.
No. It's been doing it.
No, but every new law allows for just another branch to go off of it.
They would never have banned transgender surgery if they weren't pushing it for the minors. This is a rebuttal. This is a reaction.
It is. But every single law that gets built, there's another branch that you
can't live on that. When that happens, then you could fight it.
Then we should ban TikTok. But I'm
gonna so Republican leaders across the county have banned minors from accessing trans-related care, going against the guidance of major health authorities, including the American Academy of Pediatrics and the World Health. So there is a lot of people saying that kids should have it, But under the bill, but under the bill, DeSantis signed into law this Wednesday. Healthcare restrictions will now expand to trans adults. So I didn't see that. So they're saying that under the bill Wednesday, the healthcare restrictions will, but that's not. So here's the thing. Let's just put whether or not I didn't read the bill, but here's the whole thing about this.
Click on it; it'll show you the bill.
No, I don't want to.
It might be short. It might be a paragraph.
I don't think so. I doubt it. And we'd have to interpret it. Let me go see here. It's going to be long. That's
it.
Good luck on that. There's all kinds of stuff here.
That's the bill.
And I can't. Can you read it?
Yeah. Treatments for sex reassignment, granting courts for this state temporary emergency jurisdiction over a child present in the state if the child has been subjected to or is threatened with being subjected to sex reassignment prescriptions or procedures, providing that for purposes of warrants to take physical custody of the child in certain child custody enforcement proceedings. Serious physical harm to the child includes, okay, so it just goes on that, but
there's nothing about adults. I understand your civil assault, but here's the argument. You have to come down, Sean, because the argument right now is getting out of hand. You're going to get violence. You're going to get people who are going to start, shooting people up. I want to tell everybody, calm down. Here's the thing. Where the argument is, I'm trying to get common ground on both sides. As a doctor, I'm telling you, where the argument is, where the science is not rock solid. It's not even rock solid with adults, but where it's really shaky is with children. Okay? So what I'm just saying is we should be backing off. I know there's people on both sides saying the children should be cared for. I don't think, I would rather, in my opinion, take the, let's get out of this. Let's go back. I would rather, in my opinion, take the risk and wait until the child is 18 or 21. And then if they still feel that they need to have the surgery or the medication, then do it. Is there any downside to that? There are some people saying that the sooner you do it, the better off you are. But you're talking about permanent changes. And you don't know, when you take out a girl's uterus and ovaries, you're committing them to medication. They're going to have, it's like menopause. They get weaker. I mean, there's a million medical things, more cancer, all kinds of things. When you take a boy's scrotum and penis off, you're going to have urinary tract issues. You're not going to, you're a eunuch. Basically, you can't have have a baby. You're not making sperm anymore. Your scrotum's gone. That's where sperm is made. A woman, her eggs are gone. So you're basically sterilizing yourself. Now, I don't know, if you feel that you are a man in a woman's body, gender dysphoria, does the price to pay sterilization? I think, it's worth to wait until you're 18, 19. That's where the argument is right now. It's crazy, man. I'm telling you. I think that, so here's the thing. This is another thing I want to put. And the government is paying for this stuff. This is where it drives me crazy. Legislation also has a range of insurance restrictions. Governments and public colleges and universities can't spend state money on gender-affirming care, nor can the state Medicaid program. In New Jersey, the state Medicaid, which is the medical care for poor,
Obamacare,
is paying for this. Right in New Jersey, you have United Healthcare Family Plan. There's 15 procedures that they approve. They're paying doctors to do this procedure. Now, maybe not anybody under 18, but you're 19, 20. I have no problems if you're, I think 21 should be the age. And then after that, you want to have the surgery, kumbaya.
Well, technically 25, you're not done, your brain's not done developing.
Now, So this is going on here. And so this is all about the LGBTQ rights.
What do you think about Rito's haircut?
Rito's haircut. I don't know.
What do you think about it?
What do you mean? Who's Rito?
This is Rito, I think.
Oh, is that him there? He's giving him shots right there. I don't know if he's so. Is he a boy going into a girl, or a girl going into a boy? So he's taking testosterone. So it's a woman changing into a man.
Yes.
So,
What do you think
so
about his haircut?
telehealth has grown increasingly popular. What's that?
You didn't answer the haircut.
I
You don't like
know.
it?
I don't know. I can't. You know.
I think you'd look good with hair dye.
Yeah, I don't know
Blue?
what's going on. Oh, the blue. These. Okay, you could get out of here for now. So the whole thing here is that you have these states now that are trying to ban the I want to get another one here, trying to ban this stuff and for minors. And let me just get one more article here, and then we could end this here. So we talked about the Texas. Okay, let me do this one here. So let's go here. So this is another one. Can you pull me up here? So this is the last one. So this is Texas legislature bans gender-affirming care for minors.
Want to exit out of that bottom one? Tap the X on the left.
Yeah. This just sucks because I have this. So now, again, they put the GOP. They got to talk about politics. So the GOP, which is for people, the Republicans, controlled Texas legislature on Wednesday, approved a bill that would ban gender-affirming care for minors. The bill, which now moves to the governor's desk, bans hormonal therapy, puberty blockers, and surgeries for people under 18 in the state. Now, why are they doing this? Because there's people who are trying to push it. In New Jersey right now, there's a bill, as we speak today, in New Jersey, that wants to put the age of consent to 13, which means then the 13-year-old can consent without parents' consent to themselves to have gender-affirming therapy. Now, I'm not saying pills, I'm not saying surgery, but at least counseling.
Do you think it'll get passed?
Well,
I don't think so.
I don't know, but it's 16. It's 16 right now in New Jersey. So let's read here. An exception was made for the transgender minors who were already receiving care before June 1st of 2023. So evidently, there's minors who are being treated. However, the bill says those children shall wean off any drugs provided for the proposed gender-affirming care. The bill does not specify how long patients would have to stop taking the drugs. It goes on and on and on. So this is Bill SB 14. And let me just go here. I'm looking here. So there was protesters that had to be forcibly removed from the state capitol. They demonstrated. Let me just look here. So at least 17 states have enacted laws either restricting or banning gender-affirming care for minors. And remember, gender-affirming care means even counseling. But here's the thing. In New Jersey and other states, they're pushing for patients to consent. So we say 18, right, is the age of consent. In New Jersey, the age of consent is 16. You could have sex with a 16-year-old. They could even actually sign for their own surgery. I would not do that. I would wait. I would have an 18-year-old. I would not. I want parents' consent. But you could also have an abortion in New Jersey under 18. You don't need parents' consent. 18, you can consent yourself. So if you're 12, 13, 14, and you need an abortion, state will pay for it, and you can consent yourself without parents' knowledge. So we're there already. An abortion is a procedure. It's not that risky. So it's not having genital surgery or puberty blockers, but it's still a procedure that you could consent to. So think about it. Right now, you can consent to have your an abortion. And there are complications of abortion, very minimal, but the psychological effect of having an abortion is, could be significant. So here's another one too. On the same thought here, this is in the same article here. Nebraska governor signs 12-week abortion ban, restricts 12-week abortion ban. I think that's I think 12 to 15 is reasonable. I've seen 15-week fetuses. They were aborted. They look like little human beings. So when you see this and you're doing it, it's a little bit different than this just this perception of it. And do they have rights? That little thing have rights, but also restricts on gender-affirming care for people younger than 19.
Did you hear about the kid that wore the shirt that got banned from school?
Oh, what was the shirt? I
don't know. I forget what state it was in. He wore a shirt that said there are only two genders.
Oh, and he got jammed up. Well, here they are.
Yeah, he got kicked out of school, Massachusetts.
Yeah,
that's like straight up against Supreme Court.
That's free for speech. We're going to get into that. So here's your Vice President Kamala Harris tweeted criticism of extreme so-called leaders imposing restrictive abortion laws. From North Carolina to Nebraska, extreme so-called leaders continue to restrict access to abortion across the nation, she wrote. Enough is enough. We need a federal law to restore the protection of Roe versus Wade for women in all 50 states. I will say to, respectfully...
Did Roe v. Wade get overturned?
Yeah, it did.
Yeah.
But it's the states' rights. You can do whatever you want. There's no law. United States, every state could do what they want. Like New Jersey has abortion on demand. No age, no restriction, no waiting time, and the state will pay for it. Now, I want to say to President Kamala Harris.
Why do you say it like that?
Well, just because I'm being, I want to pronounce it correctly. What about the
How else
right?
would you pronounce
What
it?
about the right of the fetus, the baby?
What's
What about the right of the father?
I'm stuck on Kamala Harris.
Kamala.
If you say it too quick, does it sound like Kamala Harris? Like, what are we?
Yeah, I don't know. Oh, that's terrible. Don't go there. Don't now. Listen. Respect this. Respect the office. Okay, we were going to respect the office. I know what you're saying. So, but this cracks me up when I listen to these young girls like my body, and it's like this little thing in there they just get rid of, So, I think I'm not against having abortion. I think in the first trimester, 4, 8, 12 weeks. That's 3 months, right? I think it's reasonable. Let me say, wait, 4, 8, that's 16. So 4, 8, 9, 10, 11, 12. Yeah, So what do you think? What time frame should be? How many months?
I haven't given it any thought. Obviously not 9 months, but
3 months is pretty. 12 to 15 weeks, I think, is reasonable.
Yeah.
That's not. Here's the thing: if you're gonna have sex, men and women, then take responsibility. You get pregnant, okay? I know it could be an accident. Well, then how about we do this? How about again have the abortion? Make sure you test yourself. You could buy the stuff in the store. If you're pregnant, okay, then you get the abortion. I'm okay with having it, from 12 weeks to 15 weeks. But after that, it's tough stuff. Unless you're sick or it could hurt the baby, hurt the woman, or rape or incest or all that. But you should know by then, But again, let's push abortion. Adoption. There's a lot of people who adopt these babies. There's a lot of people out there who've been adopted. So
there's a lot of kids that don't get adopted too, though.
Yeah, well, if you get them, Okay, so let's get out of here. So let's go me back to my board here. I want to go here. So I just want to finish this up here. So let's just put this in perspective so people have an understanding.
12 weeks.
So you have gender dysphoria. That's what we're talking about. I have people who don't even understand what this is. I don't know how many people are going to hear this, but you think that everybody's on top of this. They don't know what. So gender dysphoria is the problem.
I think this is everywhere, Cash. I think everyone hears about gender.
Well, my patients, some of these people, they have flip phones. They don't even watch the TV. So, but hopefully this will get through them. So gender dysphoria is the issue. What is gender dysphoria? People feel that they're in the wrong body, that they're a male, they should be a female, and doesn't necessarily have to be gay, But there's Jordan Peterson, which I
know
like.
we've talked about.
But
It's an inaccurate statistic. We went over it.
No, it's not anyway.
We were only hearing it because he said it one time.
No. He cited studies.
He gets fact checked all the time
Doesn't
on
matter.
the internet.
I'm telling
you, statistics are just what you want to represent.
No. Well, listen, you have to. Then the statistics. Then what they're saying
It's
is
hard to believe stats.
So then you could say this. Then the statistics that these kids should have the surgery before they're at puberty could be bullshit too.
And the ones that say otherwise also.
Right. So, but you have to somewhere along the line, your generation you have to draw a line in the sand. Take common sense, but also you have to take some of the science out there.
If you want to have a real nuanced conversation, we should take some of the science out there because it seems to be manipulated all the time and like just devise a moral code. That speaks to you. So one nation under God, we should generate some type of moral code that we all agree on.
Never happened. The founding fathers did that, and that's why we have
to do that.
They do, and this is the best you're going to get. You're never going to have utopia in this world.
No,
never.
we tried science, and science clearly is failing us.
Well, science
pure
is
hard science, pure only 100% science. Science is important.
Science always will fail you because it's an evolving entity.
Yeah.
Science is debate. That's why when you had Corona, the worst thing they could do was stop dissent, stop debate. And back in the day, they used to bleed people. Back in the day, they thought they didn't believe mosquitoes caused malaria. So things change. But getting back to what Jordan Peterson said is that a lot of these kids who have body dysphoria, and there's a lot of literature to back it up, will change their minds when they turn 18, 19 to get past it. Now, and about 80% of them will wind up being gay. So we might be dealing with a lot of gay people. I'm not saying that's the fact, but a lot of these people who are going through this are maybe just gay and they don't need the surgery. So
I can't find it. I
no,
tried
don't worry
last
about
time.
it. So give me.
We
I
always
want to show one more thing here, because this is when you talk about here's the science. Let me give you the other side of the science. Go back to my my iPad. So look at this here. So this is unbelievable. So medical school professor says parents must implement gender ideology for babies. It starts at birth. So listen to this. This is not some bullshit. So it honestly starts at birth or even before. Lauren T. Roth of Albert Einstein College of Medicine. Okay, now this is an article out of Fox News. This is published May 21st, 2023. I don't know where so let me see where this came out of. So this is written by Hannah Grossman. So this is a doctor. So a professor.
I think we looked at this last time.
It's okay to go over again. A professor at Albert Einstein College of Medicine who is involved in a LGBTQ plus special issues group, claiming that parents must start including gender ideology in their families before a baby is born. This is my favorite topic, Lauren T. Roth, professor of pediatrics at Einstein, said, Einstein, and a physician in the Division of Academic General Pediatrics at the Children's Hospital at Metaphor, said, the doctor has specialized knowledge of transgender medical interventions on children diagnosed with dysphoria. Like, this is a normal thing, and we have to understand that gender is on the spectrum. That's not just men and women, she said. Sometimes the child's gender identity matches the chromosomes or the genitals that they were born with, but sometimes it does not. So this is mainstream medicine here. Now, I don't know how much of the population of doctors, there she is right here. So this is her speaking. And so she says there's also a term non-binary, which means you're someone who doesn't necessarily identify with the categories of woman or man. And it goes on and on. It's just these are the things: gender spectrum, gender expansive. It goes on and on. Here's another one. Pentagon doctors claim prescribing transgender drugs to minors can cause psychiatric illness to melt away. Cause the psychiatric illness that they have to melt away.
Psychotic.
Yeah, psychotic, excuse me. So you got a lot of people who are pushing treatment. Here, Boston Children's Hospital director calls for the drastic increase in capacity for gender surgery for minors. This is today, Sean. This is where the battle's going on. So they want, so you have governors in Texas and Florida, right, banning it for minors. You have Children's Hospital, and I guess the state agrees with it, pushing for it. So this is a big battle going on. So as you're not a doctor, and I'm giving you these articles. So what would you say? Where is your position? Well, I know you didn't really think about it, but as a how old are you? 20? What is your age?
I'm 25. Cash.
25. So as a 25-year-old kid, yeah. Let me put me. I want to look at you. What you could get rid of this thing. So now you have all of these people. So it's not.
I literally just said I think the science is
get rid of my iPad.
I am.
What do you think? So what's your opinion? Science is not there; it's there. All these this is complex stuff. So what would you say?
You can represent it however you want. It's just.
But you're on the school board
on this topic. I don't even care.
You don't even care, and
that's how most of us are. My age, some people want this, some people don't. It's just whatever.
What about, eventually, I guess if, you have kids, you're going to have to,
Hopefully I live long enough and I can just put my chip into the internet and I can live forever and fly up Mount Everest through the digital landscape.
Well,
who knows where the world's going.
Yeah. So as a doctor, I got to deal with all this stuff and, we see it. And I think that here's the deal. Because we're a medical show and we have to discuss this stuff and we talk about it and we bring it up. And it's politics. This is where medicine and politics merge. That's why I have a show that's medical political, because it's such, the coronavirus was one. This is the new one now. And I hope we don't get banned from, YouTube for talking about this. But I think I'm going to give you my opinion. If anybody cares, this is what I'm going to tell you. because there's a lot of parents out there struggling. There's a lot of doctors struggling. One of my buddies just told me that there's medical schools that are requiring plastic surgeons to have underneath their belt or have performed certain gender affirming surgeries, or they won't get their residency qualifications in plastic surgery. So, think about that. You might be forced, or as part of your curriculum, to have to do that. So I think that there's a lot of things that are going on. You say you don't care now, but you decide to become a doctor and you want to be a plastic surgeon, and they're going to make you do it. Just like
but some people are some people are fundamentally against transplants too.
Yeah.
So
anyway,
people are against all kinds of.
So here's what I think. My opinion is this: when I looked at the literature and I've read a lot of things, and I'm a pundit, so this is just my opinion. But what I think is this: I think the kids should get care. Number one, no matter what age, if they start to have this issue, and I've heard cases where they're very young, but I think the parents need to be involved. The parents should not be involved. The parents should not be involved, which means the parents should be involved. They should not pass laws where the children are going to get care without the parents. That's number one. I think number two is that any kind of gender-affirming treatment, other than psychological counseling, okay, and maybe supportive medicines, like things for mental health that you would give somebody who's depressed or schizophrenic or something like that, would be okay until they're 18 to 21, and at that point they can make the decision whether or not they need the surgery. That's where I'm at. And then after that, okay, support it.
Cash, I'm going to say, judging by the 3 shows we've done on transgender where you said that, I think they know that. Well,
but it's always good to repeat, because not everybody will hear that other show. So anyway, that's what I want to say about that. I think that we got to stop. There's a lot of violence out there too. So we want to stop that. So anyway, I want to hit another thing here. So let's change over. We got. How are we doing on time, Sean? I want to see. Oh, we're good. Yeah. So I want to talk. This is one here that we've been talking about, and this is another recurrent thing. And this is anti-racist radicalization in medical field is causing new discrimination. So there's this thing. There's a TikTok star, medical student. His name is Joel. What is it? Bervell. How do you pronounce it?
This old dude?
No. This is a younger kid. This old dude is saying no. What's happening is that this whole thing what you talk about is transgender, not transgender, critical theory, racism, white supremacy, all of this shit is in medicine, and there's people saying that medicine is institutionally racist. And I'm telling you right now, in my world, way more than half the doctors are non-white. One of my patients just had surgery done, a heart transplant at Newark Beth Israel Hospital. It was a woman.
How many followers does this Joe Bervell guy have? Let's find out.
Yeah, and so this is Stanley Goldfarb. He's a physician who founded an organization that rebuts the left-wing push for anti-racism medicine. Said the new practice incorporates into the field are going to exacerbate the current crisis. I want to make a point about what this one kid is talking, or one guy, is this. A view that continues to prevail in the academic medical literature is that health disparities are primarily caused by, this is an important thing, follow me on this, Sean. A view that continues to prevail in the academic medical literature is that health disparities are primarily caused by systemic racism, meaning the healthcare system is not treating specific communities adequately, causing some to suffer outcomes. It's bullshit. That I can tell you right now, that is bullshit. And here's what I say, no, and this is what he says. No, the reason we have a crisis is because of personal behaviors. Bang, 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 responsibility, understanding of the risk of illnesses, and access to healthcare system. So that is true to a certain degree. Minorities may have less access. This is the nature of the crisis. It will only get worse if we put all our resources into the wrong solution to the medical problem, says Dr. Goldfarb. Believes that expanding access as well as increasing health literacy in grades K to 12 schools are the key to combating health disparities. And that's true. There's this thing out there that everything is racist. Where I live in New Jersey, I'm on staff at multiple hospitals. I'll tell you right now, at least half the doctors, nurses, PAs are non-white. When I operate in the operating room, I think I'm the only white guy in there. You know, the anesthesiology, and it's all across the board. We have in New Jersey some of the best access to medical care. Now, you know, but even when you get access, the access that they give is still fractionated. Even if you have the best insurance, you're paying $30,000, $40,000 a year for health care in New Jersey or whatever, you still have obstacles to access because the whole, you know, that's the inherent in the structure. But to say that there's systemic racism in medicine is bullshit. Is a lie. I tell you right now. Show me it. Show me. I tell this guy, what's his name? What's his name here? The guy.
Joel Bivell.
Yeah.
Burvell.
Yeah. Show me. Prove to me. I'm a doctor. I'm 66 years old. I've been practicing for over 30 years. I've trained in Philly, New York. I've been all around the world, and the United States. And here's the thing: who do you think treats people in Africa or Tortola or St. Thomas? I mean, there's hundreds of thousands of black doctors in India. Everybody in India, most doctors in India, I guarantee, are not white. So in the world, so systemic racism in the United States, it's a bullshit argument, and I just want to beat it down every time I can. Go back to my thing. I want to, I just think it irritates the shit out of me when I hear this, and there's just no premise for it. And I tell, this is why we have a problem in this country, Sean, because you have people like this guy flaming the fire of the boogeyman.
You fired up, Cash.
I know, but there is no.
Preach.
I know, there is no. This is bullshit, All right, one more thing, and then we'll end it, because we talk about a lot of things. So we got that. The racism in the schools, in the medicine, that's just a bullshit thing. I got one more I want to talk about. So this one's a little bit. Did you put me on already?
Yeah.
Yeah. So this one is interesting because it hits a lot of things. Suicide in this country is been pretty stable. How many people commit suicide, but it's been increasing in the young population. And I have a lot of reasons, why I think that, but it is. But here's an interesting thing. I saw this article. So this woman says, my husband, this is not the woman here. This is, I think my husband died by suicide. This is the article. This is in USA Today. So it says, my husband died by suicide after January 6th. So his line of duty death deserves to be honored. Okay? And this is by Dr. McClam. Now, I don't think this is Dr. McClam here. Dr. McClam, I think, is the woman's husband. So for 15 years, this is the I think the wife. For 15 years, my husband, Howie, how do you pronounce that last name? Liebengood was proud to serve as U.S. Capitol Police Officer, and we thank him for his service. He was dedicated to his work, enjoys his connections with the community, and was fond of his coworkers. Okay, and I could not have asked for any loving husband. It's terrible. But so here's the thing: January 6th, Capitol riots changed everything for my husband. All that came to an end. So it says all of that goodness came to an end following his shift on January 6, 2021. The day Howie was assigned to exterior patrol for the state office buildings during the height of the violent protest at the U.S. Capitol. Okay? When Howie came home that night after a 15-hour shift, he recounted an upsetting interaction with a protester he approached thinking he needed assistance, only to be given a Nazi salute and a shout at in German. Howie was disgusted by the attack on the institution that meant so much to him, but this particular exchange in the shadow of the Capitol obviously bothered him. Following his 15-hour shift, Howie got 2 hours of sleep before returning to work. The next day, January 7th, now it was, I don't know if it was over by then, right? It was only one day? I don't remember now. Did it all clear out? I don't remember.
It was definitely over in a day.
Yeah, so after more than 11 hours on his shift, Howie police cruiser was involved in a collision that caused him to briefly lose consciousness. Now, I don't know what that was about. The required paperwork forced him to extend his shift 15 hours, all while functioning on only 2 hours of sleep. Okay, that's right in itself is stressful, right? Okay. January 8th, some of his colleagues noticed he had seemed tired and quieter. When he returned home on January 9th, yet after another 12-hour shift, he was distant, normally ravenous after shift. He barely touched his dinner. He was scheduled to return the next day for another 12-hour shift, but he never made it. That night, he died by suicide using a service revolver. By the way, 60% of gun deaths are suicide, by the way. 60% of gun deaths. Yeah, so we got to throw that. So anyway, but here's the thing. So basically what she wants is she's asking for him to get paid or recognized as this was this was suicide was because of his work. You understand that? Okay. So what they're saying is Howie's the first death claim made pertinent to the newly enacted Public Safety Officer Support Act, which finally recognizes that in many cases like Howie's, law enforcement suicides are indeed service-connected and should be seen as what they are, deaths in the line of duty. Okay, so that's an interesting thing. My daughter died of suicide. I have five lifeguards that I've known over the past 20 years who committed suicide, who I work with personally. And I get the same old thing. There's a reason. It was because, they were bullied, or because of divorce, or because of loss of job. It goes on and on and on. And what I'm saying is this is a dangerous slope. I understand she's upset, and I understand that maybe, in some way his work stressed him out more. But there's a fundamental issue with suicide. And this is dangerous, slippery slope, because if you say, okay, his work caused that, then, if somebody was bullied in school, then those people who bullied caused that person to commit suicide, or a stress in a job, or a word, or a micro trauma. Do you understand where you're going with this? It's very dangerous. I don't think the psychiatry literature supports why somebody kills themselves. It's complex. It's multifocal. There's something in their mind, just like, gender dysphoria or being gay or being whatever. We don't know. These people who commit suicide probably have something in their brain that predisposes them to suicide. And there's triggers, no doubt about it. It could have been that. It could have been a divorce. It could have been, something else. But now to tag it to the work environment is very dangerous, in my opinion. I'm just throwing this out. So I don't know what you think about that, but
I don't even know what your point is, to be honest.
The point is that they're trying to say that his death, his suicide, was because of his work, and they want to be paid. He wants to be in line duty.
Okay, yeah. So she thinks she wants money.
Well, she wants to be recognized that that death was. She wants to blame it. There has to be. People want a reason why somebody commits suicide. There is no reason. That's my
Can you
point.
scroll up to the top?
Yeah, there is no reason. She wants this to be related to the death. Do you understand what's going to happen if you okay that? Then everybody who commits suicide, you're going to have some reason. You're going to blame it on somebody. So let's just say your wife kills herself. They're going to say, well, you bullied her, and then you go to jail because you murdered her. You see where it's going with this? This is a slippery. You talk about a slippery slope, but already, I'm saying I took care of this personally, and people now try to blame other people for everything. Everybody's a victim, and this is a very bad scenario. I think he should be getting, because he should get a pension and all of that. But to say that, it doesn't matter if it was January 6th. It could have been everything.
There doesn't seem to be a lot of information in this. It just seems to be an article.
I read this on multiple levels. What's happening now is all across the board, people, like the one in Central Regional. There was one in my high school. The girl was bullied and she killed herself. Yeah. Now the girls were charged with bullying, but not causing her death. Okay, but that's the next step. Now, so if you bully somebody, not everybody who gets bullied will kill himself. Not everybody who is at January 6th who was a cop will kill himself. You look, right now, you have 17, it was 22, you have about 17 soldiers a day killing themselves who were in Iraq and Iran. Okay, so there is cause and effect to a certain degree. So you have to be careful with this. It's a very complicated scenario. I know these things are hard to think about, but why does 17 a day soldiers committing suicide? Is it because they fought in Iraq and Iran? Is it post-traumatic stress syndrome? Was he? Again, have to be very, very careful. I'm just pointing this out. I think this is something that needs to be more evaluated, and because I just don't like when people say this is the cause of something that's hard to put a finger on. You have to be very, very careful. That's all. It's a very complicated thing, and definitely, post-traumatic. Oh, there she is right there. That's him and her. And I think she's an anesthesiologist or radiologist. I figure she's a physician. No, I mean, what are you laughing at?
I thought you were going to say something else.
No. She's a nice lady. I feel bad for her. Listen, I'm telling you, but I've been there. What you do is you blame yourself, you blame other people. But I'm just saying is that we have to be very careful as a society if we start putting blame on every suicide, because that could be very, very dangerous. And then people are responsible. Then there's lawsuits, there's financial responsibility, it could be criminal responsibility. That's all I'm saying. I said, but I think, listen, I feel bad. This is terrible, and I don't know what triggered it. And but we all have friends that we know personally that killed themselves. What was the reasoning? Was the wife? Was the baby mama? Was it the job? Was it genetics? It's a million things. You could get out of here. So anyway, why don't you talk about the thing that you want to talk about, and we'll end it real quick. So let's. I'm going to shut this down.
Up.
No, bring it up again.
No, what do you think? Do you think we should ban TikTok? Montana's trying to do it.
So tell me what happened. So just fill me in there.
The dudes from Montana, the dudes.
Is the legislation or here?
The legislation is the dudes from Montana. Governments have expressed concerns that TikTok, which is owned by the Chinese company ByteDance, may endanger sensitive user data. Yeah.
Why are they banning it? What's the reason?
They think it's Chinese spyware.
Okay.
Essentially. Now, you think that this impedes your First Amendment right?
I think it's dangerous banning anything. Yes. I know you think I'm conservative,
Okay, it's dangerous banning anything. I think we should allow children to have gender reassignment surgery.
Well, that's different. That's physical.
Why?
No, this is free speech.
Freedom of speech is very physical.
Well, I guess if you want to cut your balls off, that's free speech. I think that's real. I think that if you
do it under the guise of art, it is free speech.
I think that TikTok is let me ask you this. So how are they going to stop you from doing it? It's on the internet. How are they going to stop it? You said they're going to fine you if they see you using it on the internet?
That's what I heard. $10,000 fine.
I just think it's a dangerous thing, because you start listen, here's the thing. I would go with this. If the government, United States government, this should be a government thing, not a state thing. Number one. If it's a threat to the United States,
you mean federal? This should be a federal thing.
Right? If this is a threat to the United States, then the United States could ban it. But here's the thing: you could start stopping stuff from the internet coming through. Do we have the freest internet in the world? I think we do. I don't know.
Yeah.
I know China has a filter on what people could see in China, like Tiananmen Square. I hear that if you're in China, you can't. It doesn't exist. It doesn't exist. This has a potential to be abused. Maybe it is a spyware. Maybe let's let people know. But I don't like the idea that our government or any government is going to start stopping the internet. Here's the thing about the internet, and I know it's not different. It's different than transgender. The internet is a place where it should be free and freewheeling, and nobody should be able to knock it down. And if this is if this is a Chinese spy where you should try to educate people. I don't think children should be allowed to do it. I mean, it's a hard one. But I'm very scared about free speech and banning stuff, especially with books too. I think you need to have both sides. I think you should publicize. Say, listen, this is bad for your kids. This is a Chinese spyware. Unless if we go to war with them, or we're getting closer and closer. Why don't we put pressure on China if that's the case? Where does it come? Is it coming from China? It's China based?
It's a Chinese app.
All right. Well, why can't we say to them, listen, close it down?
What do you think will happen if we say that to them?
Well, you have to put pressure. You can't.
What pressure? What do you think we could do that
minimize tariffs?
We're gonna start taxing TikTok.
Yeah, you could. There's ways. Listen, we have ways. The country has ways to pressure everybody. My point is that there's other ways than banning it, putting the pressure on people. I think that's crazy. I don't think that's the way to do it. If it's something bad, there's got to be other ways to knock it out. And I would go to the source. And I think they had the guy in front of Congress. Didn't they have the guy who runs TikTok? given a
And
statement.
he walked the floor with our representatives. If you ever watch it.
Oh, really?
They look very foolish.
What
Talking
did
to
he
him.
say? He says, "You're full of shit."
No, he just can dance around them with like words that they don't understand. They're older people that just don't see the what's happening.
Listen, I think that
And they try to speak to him on like this authoritative level where like
Right.
he lets them
Right,
get
right,
away with
right,
it because they don't understand and he can see that.
listen, you got TikTok is bad enough. You have AI that is now. I mean, I'm listening to these people who are pushing AI and building it. Elon Musk, and they're saying, listen, that thing could be super dangerous. So our technology is getting ahead of us, and listen, let the United States put something out, the alternative to TikTok, and put information out there that
We have alternatives to TikTok. We have Facebook. We have Instagram.
Yeah.
I think the problem with TikTok isn't necessarily like the stealing of information. China's going to do that a billion other ways.
Yeah.
The problem with TikTok is that this Chinese company gets to align their algorithm in any format they want to just like how you're upset about the gender dysphoria stuff. Like it's shoving that stuff, that and other things down children's.
Okay, so Sean, we don't have the technology. You can't go in there. We don't have technology to go in there and manipulate TikTok. Oh, come on.
We can remove it from our app store.
Yeah, or well, or you could go in there and try to filter it if you want. I'm not so sure.
We can't filter it. It's a private company.
Oh, okay, all right.
We
I don't
can
think
stop it from being sold in America, and we can what they're doing fine people for using it.
Yeah, I don't know. I just think that I think that's not the good way. I think that's infringing on the First Amendment, and I think it's going to be challenged.
No, but like
it will be. It will be
I'm
challenged.
not saying that it's not a slippery slope. I'm saying this. It's propaganda machine in your hand that kids are swiping on all the time. That it's just used. It's not used to that make them anti-American. It's used to make them argue with each other.
Well, I would say this. I'm not for it, but listen, the state has the right to do it, and also people have the right to sue the state on basis of First Amendment infringement, and let it go to the Supreme Court, and let's see what the judges have to say. And they may say, listen, you're infringing. Just like I don't think it's right to burn the American flag. But that's a protected speech.
You're supposed to burn the American flag if you drop it on the floor.
No, but as a protest, it's legal. What you can't do is burn your draft card. So there are free speech is very. I'm big about following the Constitution, First Amendment, Second Amendment, so forth.
Yeah, but the Constitution was written 300 years ago on a feather. This is happening in
real
time.
Nothing's changed. We're still killing each other. Nothing. Human nature has not changed. Technology has, but human nature hasn't.
Yeah, but technology is the problem, and technology is smarter than human nature at this point. That's the problem with AI.
Right.
That's the problem with these algorithms.
Right, and that's even more reason why you want to go back to the founding fathers, because they based this government on trying to counteract the bad parts of human nature. So on that thought, let's listen. We're getting long-winded here. Is there anything else that you wanted to talk about before we shut down the operation here?
No.
I think it was a good show. I think that
next week we will be talking about a different subject besides transgender.
Yeah, we're gonna. Well, this is you know what it is though.
And how to repeat the same articles.
I know it keeps on coming. Listen, thank you everyone. We have a show also called Lifeguards Off Duty with Dr. Michael Kachmar. Please
check it out.
Check it out. We're gonna have a show tomorrow night.
Yes.
So we have a show tomorrow night. It's called Lifeguards Off Duty with Dr. Michael Kachmar. We have new shirts that we're gonna start selling. My show here, we have this. Here's our studio here. Give a little picture. We have a show here every. We try to do it every week, and we try to bring you some medicine stuff. But the transgender stuff, I tell you, is to my heart, because I think it's just this crazy surgery. But anyway,
those algorithms are getting on your phone, telling you what to look at.
No,
That's
I see it in the hospitals. I see there's a big. They're going to open up a big center in Toms River, 3-story building, just to do all this in state of New Jersey.
No, I'm not saying that things aren't happening, but I'm saying you notice it more because your algorithm tells you to.
Because I see it as a doctor. I was at a lecture the other day. Doctors were talking about doing the surgery, and they want to push it. There was a pediatrician, there was a plastic surgeon, and they were talking about us. And they also went into pronouns and shit like that. So, and I think they're wrong. I don't believe it. And as a physician, I had a nurse come in the other day. Her kid, she said by 10 years old, she knew the kid was had gender dysphoria, and he's just having he's having now treatment. I think the kid's, I don't know how old she said, 25 years old. I got patients, families. It's a real thing, and everybody's struggling with it, and people are looking for advice and direction, and, we're fighting among ourselves here. I'm trying to give some clarity. That's where my thing is. But anyway, anything, Sean, you want to say goodbye?
No, that's it.
All right, Sean. Well, thank you for being here.
Thank you, everyone, for paying attention. Follow, like, subscribe, turn on notifications. Check us out. Come back.
All right, we'll see you next week.
We'll see you next week.
All right, bye-bye.